We're here at Microcap 2025. I have David here from Accurex. Now, Accurex is no stranger to the Big Biz Show, are you?
That's right.
Last time I remember working with you on the Big Biz Show, you guys were developing one of the first new antibiotics that had been developed in years. Tell me about that and where you guys are now.
Sure, happy to, Devin. Our lead antibiotic program is now completely phase 3 ready. We met with the Europeans and the FDA from a regulatory perspective. They both agreed on the same phase 3 protocol. The manufacturing is set. The clinical side is set. Preclinical, non-clinical, they call it. It's all set. They agree on the protocol and the fact that if the phase 3 trials work out, we need no other clinical trials. We can file for approval, both in the US and in Europe. But the real, kind of emotional thing is most of the C. difficile, kind of like in terms of proportions, is in low income, poverty, and third world countries. And that's where the problem is the worst. And because our cost of goods is so low, to your question, your point, we're going to be able to get our drug available worldwide, not just in the major markets.
Right on. So this really captures an unmet need.
Yes.
Out in the global economy. What are some other plans? What's been new since that? I mean, you guys have had a couple new developments over the year, and now we're leading up to Microcap. Catch me up to speed.
Yep. So we have a second and third program, same drug, same mechanism of action, novel, first new class in over 30 years. We knew it was for MRSA. We talked about that with Sully. Now we found out through some laboratory study that we did at the University of Florida, independent lab, that it's also useful to kill anthrax bacteria.
And potentially deadly form of anthrax.
Rare inhaled form of anthrax. Concerns over anthrax in Florida after one man died from the illness and his coworker was contaminated.
And in particular, anthrax bacteria that is resistant to frontline therapy for anthrax, which is levofloxacin. So that's a really exciting development because that's the kind of thing that's a hook for some of this government funding that we're applying for. The government, obviously, for bioterror threats, stockpiles.
That's crazy. You guys found a fix for anthrax.
Yes, we have. It appears that way. At least early data suggests that it's promising enough that we should continue.
You guys have a lot of cool different angles going on here. What's your experience been at Microcap so far? Has there been anything interesting that you guys have encountered? Any cool deals that you want to tell us about?
I see a lot of deals happening. I see a lot of investors putting money to work. I think there's a lot more hope than there was a year ago for a lot of reasons, but I think with interest rates and some other factors, I think it's going to be a bit choppy. There's a lot of executive orders and things that are happening. I think many of them will be very good, but
the last 2 years have been tough.
Yes.
The Fed hiking rates by a quarter percentage point.
The US Federal Reserve has again raised its key interest rate by 0.75 percentage point.
The Federal Reserve did keep its interest rates unchanged. The Fed leaving rates steady where they are in this decision.
No doubt about it. And there was optimism there, but then a little bit of fizzle out. But it's refreshing to hear coming into this year with the new administration and everything that hope is even stronger now.
It's the strongest I've seen. So I'm really positive. I think there's a lot of really positive sentiment out there. For our program in particular, for 43 million, we went from preclinical to literally phase 3 ready. And if you talk to other folks that develop antibiotics, the response I get is, you guys are running this thing on a shoestring. And in fact, we are.
And folks at home, just for context, FDA clinical trials of any sort, I think there should be a presidential medal just for getting through the FDA trials. Yeah. They're never consistent. It's very complicated depending on your medication. And for you guys to be at the end of that, that must feel really good.
Oh, it's great. It's very fulfilling. It'll feel really good when I'm working on the next one after I've placed this one in the right hands.
That's awesome. And I love that, placing it in the right hands. Where do you think those hands will be?
I have a lot of conversations, and I get chills up and down my spine just hearing the question right now. But I don't know exactly whose hands those will be, but I know I'll know them when I see them. If that makes any sense.
Hey, that's how I've been dating since I was 16. All right. Hey guys, this has been Devin with David Lucci of Accurex. You're watching The Big Biz Show. Thank you, David.
Thanks, Devin.
175 countries and all the ships at sea on the American Forces Network. To our brave men and women of the United States Armed Forces, as always, thank you for what you do, what you've done for us. Big Biz Show rolls on from inside the Loft 100 Studios. Costa, Mary Britt Godwin, Greg Todorov, and of course, Sully.
Good to see you. Don't forget our Biz TV audience. Right here in the U.S., 125 million TV home strong with American Life Network and Biz TV. Okay. Mary, it's one of your favorite subjects.
You always point to the female every time.
No, because you're the one who told us about this thing called GLP-1. No, you're the last person that needs it.
No, I mean, I need it too, but I am very nervous about the risks of these, and I feel like they need to be around a little bit longer before I try them, which is why I am excited to talk to this next guest.
And that next guest is Mitchell Steiner. Of course, he's the chairman, CEO, president, and founder of Veru Incorporated. His ticker symbol, their ticker symbol, is VERU. V as in victory, ERU. Mitchell, welcome to the show, sir. How are you?
I'm doing great. Thank you for having me. I appreciate it.
That's a Dr. Steiner to you.
Dr. Steiner, my friend. Thank you for coming on the show.
I will be happy.
Great guy. I've had a chance to talk to him over the last few days. 1 out of every 8 adults is taking one of these drugs to lose weight, and that's the Ozempic, Wegovy, Saxenda. I think it's Monjaro, Zepbound. Mary,
Yeah, I mean, I do know lots of people that are on them, and I'm curious about the risks and the adverse side effects. I heard one of them is losing muscle, which is something that your new drug is out to battle that, right? So talk to us about the risks and then what you guys are doing to help that.
Yeah, in fact, the call to action for our company was we had a drug called enobosarm, and we'll all talk about that in a moment. But the problem that we found out is that 1 in 5 people are actually on a GLP-1. GLP-1 is that category of drugs that basically the name brands that Sully was talking about. And with that said, the big problem is you lose weight. And it's very effective in causing you to lose weight. The problem is the exchange rate is about 50% of the weight that you lose is muscle or lean mass. So another way of thinking of it, for every pound of fat that you lose, you have to lose a pound of muscle. Now that's fine up to a point, but when you lose too much muscle, the body starts saying that you can't do that. It goes into a self-preservation mode, and you start to hit what's called a plateau. So one of the things that people find with these drugs is that they find out they lose weight, and then they stop losing weight.
Mitch, talk about enobosarm. That's your drug. Am I saying that correctly? Is it enobosarm?
No, it's perfect. Enobosarm. Think of enobosarm as a safer testosterone, and the drug was made to be a non-steroidal agent that can be given to women and men. So can you imagine having a drug that can build bone, maintain and build muscle, decrease fat, and it sounds just like testosterone for men, but women can take it too. And it's an oral agent; you can take it once a day, and it improves physical function. So, what's a better drug to try to go after this muscle loss that happens with these GLP-1s?
What's interesting is that you guys just recently reported some top-line clinical results. Talk about that. That showed some promise.
Yeah. So the question that came up was, can we do a hard pivot? And that's what our company did. We put all our resources behind this. We did a phase 2B study, 168 patients that are obese, have obesity or overweight, over the age of 60. We picked older patients because there's no question older patients are most at risk for losing muscle because they lose muscle with age. And if you lose muscle with age and you happen to have obesity on top of that, and you take a drug of this sort and you start losing 40% of your lean mass in the weight that you lose, then you can see how you can set up a problem. Our situation is we ran this study, 168 patients, and we reported top-line data in January. And what's fascinating is the whole story can be told based on the data. So, for example, we did show in this study where we compared patients that had taken just the Wegovy by itself with Wegovy plus enobosarm 3 milligrams, enobosarm 6 milligrams, so 2 different doses of enobosarm. Let patients go for 16 weeks and came back and asked the question, were we able to preserve muscle? The answer is absolutely yes. We were able to preserve muscle. It turns out that in the enobosarm group, 71% of muscle was preserved compared to Wegovy by itself. Interestingly, the 3 milligram group, 1% of, say it a different way, 99% of the muscle was preserved compared to Wegovy. And then fat loss, which the other thing we reported, 46% more fat loss in that period of time. And that 46% of the fat loss happened in the 6 milligram group, highly statistically significant. And so the question begins, let me get this right. You're losing muscle, you're preserving muscle, and you're losing more fat. What happened to weight? Well, the whole goal here is to have a better weight loss, meaning that the weight that you lose is mostly fat and not muscle, because the fat is the problem with the diseases that you see related to obesity. And sure enough, what did we show? We showed with semaglutide or the Wegovy alone, we showed what you expect. 16 weeks, 32% of the weight that you lost was lean mass, and 68% was fat. With the Enobosarm, the 3 milligram group, it turned out that 99.1% was fat and 1% was lean. I know, it's unbelievable. So can you imagine now that you've taken a drug, a GLP-1 drug like Wegovy, which is non-selective. Remember, when you're starving, you lose muscle and you almost lose equal fat. But you add the Enobosarm to this combination, and what you find is that, you tell the muscle to stay preserved, and you tell fat to burn more. The only way you can have the same weight loss, which is what we saw, essentially no difference in weight loss in the groups, is you have to lose more fat. Because people always know if you hold on to muscle, and muscle's heavier than fat, you got to lose more fat. Right. Make up for it to get to the same weight, and we saw that. But here's the stunning thing with the results. In order to have a problem, you have to have a problem. Meaning, does it really matter? It does matter, because it turns out that 32% of lean that was lost in the placebo group on Wegovy alone, it turns out 42.6% of these patients had a decline in stair climb power of greater than 10%. Jeez. That's like having 8 to 10 years of stair climb power loss in 16 weeks.
And there's bone density and so on and so forth that muscle mass brings you, and so on and so forth.
Dr. Mitchell Steiner is the chairman, CEO, president, and founder of Veru Incorporated, their ticker symbol VERU. Doc, I'm currently on Lardasa, and it's not doing anything for me to take my weight off. Of the people that are taking yours or any of the GLP-1s out there, do you know, are they doing a good job of being able to keep that weight off once they've kind of hit their target fat they wanted to drop?
It's a good question. And so the problem is it depends if they stay on the GLP-1 or not. But be clear that Enobosarm, just back to physical function for 1 second, the physical function improves with Enobosarm. So that means by holding on to the lean mass, you actually improve physical function, stop the decline. That's critical. To answer your question, there's 2 problems that happen. First problem is you stay on the GLP-1, you hit a plateau. That means you lose weight, and then all of a sudden you don't lose weight anymore, and that's a problem. People get frustrated. In fact, with one of the studies that Wegovy did, it was 4.25 years of staying at the same weight. That was not people didn't like that. Yeah. They lost select trial. They lost 10%.
That's a heck of a plateau for 4 years.
Well, I'm amazed the placebo patients stayed on the study. Oh. And but the other problem that happens that we're trying to address is that when you stop the GLP-1, your body responds by having regained fat and regain weight. So people get very frustrated because they want to come off the drug for some reason, access, GI toxicity. There's a lot of reasons why people want to come off of GLP-1. And then they realize, oh my gosh, and now I've gained all the weight back, and it came back as fat, and the muscle didn't come back.
So Mitch, what you're saying is when they lose the muscle and they regained it, it didn't come back as muscle. It came back as more fat.
What happens is fat comes back first. So you regain the fat first, and then muscle will come next. And so what we're trying to show with our drug, and these data will come out in second quarter, we'll call it maintenance. We think it's just as important to stop a drug and make sure the weight doesn't come back in fat. And so we're hoping to show in second quarter that Enobosarm helps patients by, when you stop a GLP-1, that you'll find that your fat regain can be blunted, or even better, show that you continue to lose fat. That would be very, very good.
Is this? Can we call this the next gen of the GLP-1?
Yes. This is a great way to think of it. Well, if you had to design the next generation of weight loss drugs, it's not about how much weight you can lose and how fast you can lose. It's the quality of the weight, meaning what's the tissue composition. As I just told you, we're at 3 milligrams of Enobosarm with Wegovy, 99% of it's fat and 1% of it's lean mass. That's pretty good. And so if you can do that, then that's your next generation, because you converted a non-selective GLP-1 where you lose muscle and fat equally to one that, in combination with Enobosarm, now you're selectively losing fat and leaving muscle alone. That I would call next generation drug.
He is Dr. Mitchell Steiner, the chairman, CEO, president, and founder of Veru Incorporated, VERU Inc. Of course, their ticker symbol is VERU. Dr. Steiner.
We're going to cover this company.
My gosh.
He'll be back with us. He's going to come to San Diego. We're going to pin him in the corner, let Mary talk to him for 15 minutes about the next gen drug.
Dr. Steiner, thank you so much.
That's a deal.
All right, keep it here.
Thanks so much. Good stuff.
Keep it here, everybody else. Lots more to come with the Big Biz Show. Inside the Loft 100 studios here in beautiful Southern California. Wherever you're watching, wherever you're listening, thanks for being along for the ride. It is the Big Biz Show. Those handsome guys up on stage, the best in the business. Of course, we call them the Day Trader Trio here at the Bar Costa. Mary Bert Godwin, our executive producers, Greg Todorov, and Sully.
I'm excited because this month marks...
Oh, it's coming.
My birthday?
We are getting very close to...
And your birthday, Mary Bert Godwin.
Don't forget it's my birthday month.
You got your birthday, you got Matt's birthday this month? Is this Leo season?
No, Leo is...
Aries season.
Yeah, Leo is July to August.
Harry season.
Waxing season.
And baseball.
Baseball.
So are you excited? Mike, of course.
Yeah.
Nationally recognized sportscaster.
Excited.
Do you remember what game this was that Ozzy Osbourne was trying to...
I can't remember.
It's Cubs, but I don't know what the game was.
That's not Harry Carey, that's Ozzy Osbourne. I know you thought it was Harry Carey.
Was he loaded?
I thought it was Dick Clark.
Was
Sorry.
he loaded or was he stroking out when that happened? What was happening?
I think
both.
the last 6 years of his career, I think when he was snorting ants off the sidewalk right before he walked into Wrigley.
The sad thing is, I think he actually thought he sounded really, really good.
Well, they released it.
Yeah.
We have the recording.
Great job, Oz.
Who's our next guest? Greg?
Monty
Bennett. Excited to hear Monty Bennett because
Me too.
You hear there's two paths to wealth in this country. You either have to own equities, stocks, or you have to own real estate. Well, guess what? They figured out a way to do both. It's called a real estate investment trust. And of course, with AHT REITs, BHR REITs, and of course, the Ashford Group of Company. Who do we got coming up next, Michael?
This is Mr. Monty Bennett. He's the chairman and the CEO. Mr. Bennett, thank you so much for your time today. How are you, sir?
Hello, how are you? Great to see you.
You too. Monty, I got to ask you, because you are the chairman and CEO of the Ashford Group of Companies. We've got Ashford, which is stock symbol AINC. You've got you have the AHT REIT, Real Estate Investment Trust, and then you have the BHR REIT, Real Estate Investment Trust. Talk about all three companies and how they differ and so on and so forth. How do you have time to even be on TV if you're chairman and CEO of three public companies?
Sure. The BHR is a REIT, Braemar Hotels and Resorts, and they're really high-end hotels in that REIT. The other one, AHT, that's also a REIT, and that's all other kinds of hotels, from mid-scales to upper upscales, even some luxury in that one, just a much bigger basket of hotels. And then the third company, Ashford Inc., that's an operating company. It manages the REITs and has a number of operating businesses related to the hotel industry, such as a water sports business and an audiovisual company and a property management company and these kinds of things.
When you guys, when you specifically, Monty, take a look, at an acquisition, let's say, or let's say take a look at another business model or another revenue funnel, are we looking at cutting expenses? Are we looking at growth first? Are we looking at how we can make it bigger, better, faster, stronger than the next guy? What are your pillars when you take a look at something that you're going to move into next? Because I know this can't be the last of it.
Well, it has lots to do with the times that you're in. And what most people don't know is that the hotel industry has not recovered from COVID.
No kidding.
And while revenues are about where they were in 2019, expenses are up 50% from where they were, and interest rates are up much higher. So because of that, there's no new construction going on essentially in the hotel industry. And whenever these dynamics happen, where there's no new construction for a period of years, demand catches up to supply and surpasses supply, and you have a period of great economic returns. So right now, if you're out there buying hotels, generally you're going to do well no matter what you focus on, whether it's a cost containment play, a revenue enhancement play, or sometimes you change the brand, sometimes you change the management. There's all different kinds of things you can do, and we try to do all of them, or as many of as we can. But at this point in the cycle, no matter what you do, you're going to do well.
Monty Bennett is the chairman and CEO of the Ashford Group of Companies. Monty, do you foresee that changing? I mean, do you think soon we'll get to the point where you can say, well, as far as the hotel industry, we're back from COVID?
We've recovered.
Excuse me.
I think it'll take another few years. Like I said, the revenues are where we were, but with costs being so much higher with inflation and with interest rates, we get promises about interest rates coming down, but they haven't. So my guess would be 2 or 3 more years until we get to the same economic level that we were in 2019, which means there's some good buys out there right now.
Hey, Monty, I've got to talk about the political environment because we talk about the economy and the stock market every day in this program. And of course, the stock market is not the economy. They're two different things. But then again, you talk about the real estate business and the hospitality business. And I don't think I've ever asked anybody in your business how it relates to the political environment. Is your antenna up a little bit right now? Is there tailwinds? Is there headwinds? What are you thinking in terms of the political environment as it relates to the backdrop and economic outlook in your industry?
Well, we've been promised a new golden age. We haven't seen it yet, but we're hopeful. Revenues are up a little bit more than what most of the pundits have said, but really no big movement. I think what's going to really help us is if those interest rates come down. And we've got the president jawboning that he wants them down, but in the end, that's up to the Federal Reserve. Then you also hear, I don't know if you guys have heard these reports about the first quarter coming in kind of soft. We're not seeing that in our numbers, but anything that might encourage the Federal Reserve to lower interest rates would be very welcome by us.
Well, one of the reasons you're not seeing it in your numbers is because you guys did the right thing as a company for shareholders, that you reduced your compensation. I mean, that's, when I see companies do stock buybacks and I see the reduction in board salaries and such like that, you guys are really walking the walk. You don't see that very often. How tough is that to do in this day and age, especially since you are still recovering from COVID? Was that a tough decision for your board to make?
No, not really. I mean, it's something that we had to do. We felt like if we're going to start cutting back, then everybody needs to cut back, including myself, including our board members. And that's what we all did. So board members cut their comp back by half, I think, over in our trust platform. My compensation there fell by maybe 2/3 or more. And we're asking our people to tighten their belts, so we need to do the same.
Monty, if you need a place to stay, you're here in San Diego, we got a place for you. Hey, listen, I want to talk to you real quickly about Remington. You have a Remington hospitality brand that we didn't talk about in the very beginning. What is that exactly?
That's an operating company. It's a manager. When you go and you check into a hotel such as a Marriott or a Westin, it's usually not Marriott or Westin managing the hotel. It's companies like Remington, and they operate it. We operate it. It's under license from those flags. So those guys are the brands, we call them. And then most hotels are operated by independent owner-operators or independent operators, such as Remington. We manage about 120 properties across the country, some for our own account.
Wow.
Assets that we own, and some for others.
So let's talk about, before we let you out of here today, first of all, we'd love to have you back on the air if you join us, because we don't ever get a chance to talk to real estate people ever, especially in the hospitality business. If you think in terms of your portfolio companies, is there any, what we used to call back in the 90s, I'm sure you remember, vertical integration? Is there any sort of knitting of services and such to where you can take advantage of the fact that you have, it's kind of a diverse portfolio there?
There are, and we try to. If you look at owning those hotels, we try to be vertically integrated in that. We'll do the asset management of those hotels. We'll do the property management through Remington. And then we have these other operating platforms such as Audiovisual, which is another company that comes in and services our hotels, and third-party hotels. Red Water Sports that comes in and services our hotels, and other hotels for those that are on the water and need water sports type rentals and the like for customers. So we try to do as much vertical integration as we can. We even have a property development and renovation company that will renovate and build hotels.
He is Monty Bennett, the chairman and CEO of the Ashford Group of Companies. Mr. Bennett, please promise that you come back on the show with us.
We want to have you in San Diego. Plus, like I said, we got a couple spare casitas here.
Exactly.
You kind of by 2/3.
Monty, thank you so much. All right, keep it right here. There is much more to come with The Big Biz Show. Big B Show rolls on inside the Lock 100 studios. We are here in sunny Southern California. Wherever you are watching and or listening, as always, thanks for being along for the ride. I'm Costa, Marybert Godwin, Greg Todorov, our executive producer, and of course, Sully.
Good to see you guys. A very special guest in the studio.
Yes.
Our good buddy Jules.
Yep.
Jules, the pastrami guy.
Pastrami Jules.
You know, I got a guy who makes pastrami.
Yep.
Who also dabbles in small personal loans, laundromats, and public companies. Trust me. One of the greatest guys ever. In fact, we got a chance to feature Jules on a local television show here about his pastrami only, and it was
Oh man,
one of the greatest career moments of my life. Mike, introduce our guest, please.
This is the CEO of Indaptus Therapeutics. Their ticker symbol is INDP, and he right now has proved to us that he is a full show guest. We're talking with Mr. Jeffrey Meckler, who's kind enough to be with us in studio. But we just spent the whole 15 minutes before this segment talking Ohio State football. He is.
You mean the
Ohio State University.
Football.
So please have him back.
OH.
Have him back for the full show. I mean, we'll talk business, we'll talk therapeutics and stuff, but the football stuff's awesome too.
Should we talk about the Rose Bowl? I'm an Ohio State fan as well, my friend.
I want to make sure you're not a Wolverine.
No, he's a Wolverine fan. I don't know why he's saying he's
I'm a Spartan.
Ohio State fan.
What are you talking about? Spartan.
He's a,
Lansing.
He's a go.
State is fine.
I went to San Diego State.
He's a go blue guy.
We're Aztecs.
Sully's a go blue guy.
Yeah.
Well, it was good to see you, Jeff. Thanks for coming in.
That does it with the Big Biz Show. See you next week. Jeffrey flew all the way in to take that kind of abuse. So let me pontificate and gesture wildly about the biotech industry. So in 2023, you had a horrible year in biotech as a whole. We did. 2024, same thing. JP Morgan comes out at the beginning of 2024, however, and says things are going to be fine. There's going to be a JP Morgan conference. Remember the 2020?
Oh, yeah.
It was the last couple of years were something, and you're not going to raise any money for the first quarter of 2024, but then things will be sunshine. Well, sure enough, second quarter of last year, money was flowing, and then it was wah, 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 wah. Yep. And then third and fourth quarter, biotech just took us a slam. It seems to me that, of course, JP Morgan conference was very cautious this year of what they said, but it seems like things are actually looking up. Things are coming out of this thing. Talk to us about biotech as a whole first before we get to your company. How are you feeling as a CEO of a public company for biotech when you guys are in a treadmill trying to raise money? Not you guys personally, but I mean the industry.
Us personally. So biotech in general, if you go back for the last, we had a big bump in COVID, which just sent all of these stocks crazy.
Was that because the vaccines cut in line to get the approvals and with the FDA? Because obviously people thought it was a rush job. It wasn't really a rush job. It was basically they just got to go to the front of the line.
So I think it was broader than that. I think a lot of people it took the focus of it. And don't forget, Pfizer was selling like 40 billion of COVID vaccine. So they just saw the return on the
emphasis was on a different syllable, right?
Yep.
I mean, right?
But I think that it was too much enthusiasm at that point. Mm-hmm. And biotech, if you've been around this for decades, it goes up, it goes down. I think the other thing that's gone on, you had interest rates going up. That always makes it a little tougher for biotech.
Sure.
And I think the ecosystem of how a lot of these companies get formed, it used to be you had some seed money, then the VCs came in, then the crossovers, then the IPO guys, then the hedgies, then the long terms.
Sure.
There's this that world has changed.
So let's talk about that, because people say, well, people are investing in biotech. People own biotech stocks. That money doesn't go to the company. That's an auction. Mm-hmm. The stock isn't, except for your IPO, it's an auction. So what type of investor says, okay, I'm going to park $50 million on a great bet, a good bunch of scientists, a good business model, but it's going to be 7 years? What kind of investors do that these days?
In the public markets, just a few of the long-only big, your Fidelities, your T. Rows, those funds that have the scale and the ability to sit long. The hedgies don't, and everyone else in that, the VCs who start these companies, the crossovers, they're out. They can write those checks, but they're out within some period of time. They don't stick around for the drug. They have a
the risk aversion model, where they're right.
They come in with a hypothesis that if this data point, whether it's phase 2 data or getting in the clinic or something, they're around at that catalyst. And when that occurs, they then take their risk off the table. And because, in a prior life, I worked at Pfizer, and I worked in a corporate group that did acquisitions. And the thing is, there's not just the technical risk, there's the regulatory risk, there's the commercial risk. And when you layer all these risks onto a investment, particularly in one where, we're not going to be able to grow the overall business. Don't forget, most drugs are generic now.
Sure.
The majority of pills being sold.
So you take it to the 5-yard line and get a bigger company to take it to the goal line and then
exactly.
market, right? Mm-hmm. So for you, you guys have money in the bank. You guys are doing well in terms of marching down that FDA arc of the story and so on and so forth. How does Johnny Lunchbucket's company over here though raise capital to cure the liver cancer or raise capital to deal with that MS problem?
Well, it's interesting for the companies that are preclinical. There's still a market. So if you go back and you look at the venture firms have raised money over the last few years, they raised a lot of new funds post-COVID. So I think there's money there. If Endpoints is one of the trade journals. You look at it, there's always a new fund. There's always funding, 50 million, 100 million to start this company out of some lab or somewhere. I think the real problem is once they get going, how do they get that IPO'd? Because the IPO market's been terrible.
Yeah.
And how they go forward.
There used to be 14 a month back in 1998.
Yeah, you could
There's 14 a year now.
Yeah, what's going on? And that's where I think there's a big problem. And it's a fundamental ecosystem problem of getting these companies out. So what's happened is the VCs now all are kind of holding on longer. You're seeing that dynamic change where they can't exit at the IPO like they used to. It's a different game, and the markets haven't all evolved. For us, we've been fortunate, but we went public through a reverse merger. So we bypassed all of that.
But still, the capital formation game was still afoot.
We were right at the end.
Gotcha.
We were struggling to try to pull it together as a private. We found we could find capital, and of course,
the minute you became public, I say this all the time. If you have a shoelace retipping company that's public and a cure for cancers is private, I'll raise money faster for the shoelace retipping company that's publicly traded, right?
Yeah.
He is Jeff Meckler, the CEO of Indaptus Therapeutics. Their ticker symbol is INDP. So talk to us about your company and tumor regression and what you guys are doing.
So Indaptus is actually based on a phenomenon that's been observed for literally hundreds of years. In fact, Saint Peregrine is the patron saint of cancer. And priest had cancer, got an infection.
Wait, who drew the short straw there?
Got an infection. They thought he would die. He survived the infection and he cured his cancer.
Oh.
So this is observed for hundreds of years. Fast forward, about 100 so years ago, a doctor realized that, William Coley at what's now Sloan Kettering, realized that you could kill bacteria and inject it. So it wasn't the bacteria or the whatever was causing the infection, it was an immune response. And he came up with a therapy where he killed bacteria and injected it into people. And it's our first immunotherapy. So fast forward to us. What we do is we look at that and we say, well, this is caused by bacteria having all of these immune agonists, all these ways to activate the immune system. Let's figure out a way we could give it safely. The problem with Coley and a problem with a lot of these systemic approaches is toxicity. And what we've been able to do is develop a way where we engineer the bacteria. And by engineering it and reducing what's called the lipopolysaccharide, what this is the most potent immune response in bacteria. By cutting that down, we can give it safely, and we create this pulse that we turn the immune system on and off.
And there's a graphic that we're looking at here for our viewers.
Oh, yeah.
If you look behind you, you can see the big screen here.
Yeah.
But what's interesting here is because you may be listening to us in Bahrain across the pond. You may be watching us in New York City. We're nationwide, coast to coast, and worldwide. However, you're here in San Diego, and we're an immunology center. We're in the cancer research center of the world here. You're here, and we're lucky to have you in studio here because you're here for a conference this week. We'll talk about that in 1 second. But at the same time, you have what you're calling a decoy technology, right?
Yeah, so decoy is faking the body out that you have a bacteria infection.
I do that every time Greg and I have a tequila night. I fake the body out the next day.
That's right. That's how we treat
that I'm not in my 60s. I fake my body out that we're
Every
still in
time
our
I
early
eat a
20s.
hamburger, I tell myself it's quinoa. So it's great. It's great.
Stay here. I'm going to keep you for an extra segment here because, and if you're here for the rest of the week, we may have you back anyway. You can host the show here on Thursday before you
Nice.
His name, Jeffrey Meckler, CEO, Indaptus Therapeutics, INDP is their stock ticker, INDP. If you want to go online and check them out, you can go to indaptusrx.com or visit our website, bigbizshow.com. Immunotherapy reimagined. Big Biz Show continues to visit that.
We continue from the Loft 100 studios here in sunny Southern California. Hope you're all having a great day. We certainly are. Happy enough and lucky enough to have Jeff Meckler in studio. Of course, he's the CEO. Indaptus Therapeutics, their ticker symbol is INDP.
125 million TV homes in the U.S. Of course, let's not forget American Forces Network in 175 countries and all the ships at sea. Big Biz Show on the air. Big hello to the Day Trader Trio. Jeffrey, talk to us about the actual technology. What does it do, and where are you at in terms of the arc of the story with the FDA?
Great. So we are actually in the clinic, and the exciting point for us in the time this year is a big point of the arc. Is in the fall, the fourth quarter, we signed a deal with BeiGene. BeiGene makes a product called a PD-1, programmed cell death. The number one selling drug in the world is Keytruda. It's a PD-1 by Merck, $30 billion. This is the number one cancer therapy. What we have found in our preclinical work is when you give a decoy therapeutic and a PD-1 in mice, we saw 80 to 100% eradication. That means the tumors were completely clear. Wow. It's incredible. Now, these are mice and these aren't humans. But the important thing for us was partnering with BeiGene to then, we've now finished most of our initial safety data. We can now do a partnering where we put this immune agonist together with the PD-1 and see what it will do in humans.
Amazing.
And it's a safety study, so the whole goal is to make sure it's safe.
Of course.
But if we give it to 20 or 30 patients and we're doing it in an area that PD-1s don't work in, and we see any responses, this is very meaningful.
How is it administered?
This is an IV.
Okay.
So what we do is we engineer the bacteria, we kill it, we process it. It's in a little vial. It's put in an IV bag. It's about an hour infusion, and it's given once a week.
With respect to addressable market, which is a horrible thing to talk about, but still it's a business metric for you guys.
Yeah.
Talk about addressable market in the U.S. and also worldwide.
So worldwide, the immuno-oncology market alone is over $100 billion.
Wow.
100
billion.
100 billion.
Wow.
10,000 million.
Wow. And so that's the market for us in immuno-oncology. Now, the other thing is this technology could work in antivirals. Today, we just announced we got a whole bunch of patents for antiviral work, both in HIV and in hepatitis B. And so we're building that IP estate around. But this could work in vaccines, it could work in antivirals. Our first foray is oncology. But if you start adding up what is the antiviral market,
now you got a vertical market.
It's huge.
How hard is it to stay in your lane, though?
Yeah, that's a
you
good
see
point.
all of these, and not saying that you shouldn't, because thank God you're thinking about other verticals you can get into. But is it kind of hard to keep your eye on that first carrot and then?
Oh, I thought you were talking about the Ohio State versus the Browns and versus the Guardians.
That's another show that he's coming in for.
So it's actually really easy. First of all, going into advanced cancer is the easiest from a development standpoint. The FDA, the patients we're going after are really sick. They have no other options. Whereas you go into vaccines or antivirals, you start out with a lot more toxicology work, a lot more early development work. So it's easy to stay in the lane and stay focused on oncology and prove the technology. Our goal actually is to license the other technologies out. Building an antiviral company or building vaccines, this requires infrastructure that it wouldn't make sense. Someone who's better funded and has that infrastructure and capability. We just need to prove it can work.
When you talk about your history with Pfizer, you have to bring up companies like Merck as well, SmithKline. Do you start talking to these guys now at these conferences in terms of okay, we're at the 8-yard line at this date coming up after we go through efficacy, we go through the NDA. At what point do you start thinking in terms of commercialization?
Well, you really,
or do you do that from the very beginning?
You do that from the very beginning. When you look at how Pfizer's, Merck's, and all these companies, when the product, before it's even in the clinic, there is a target product profile. You look at the addressable market, you look at what the competitors could be, you look at what the pricing could be, you look at what the regulatory approval process will look like. All of that is done, and it's constantly updated as you're moving along. That's why you see companies, 1 year, they're all excited about a certain molecule or a program, and 2 years later, it's off the chart. And the reason is the world shifted, the data came out differently, whatever. You want to keep in contact with these companies, and it's a communication, because at some point, data pops. Let's say, we administer it, and by the end of the year, we have data in X number of patients. If I have responses in more than one.
Yeah, because they don't want to be there late either, right?
No, they want to be there at the point where the certainty has changed, but there's still economic value.
What is a partnership? I've seen a number of companies that do partnerships pre-NDA with some of these companies. What's the strategy there? And I know you're a CEO of a public company, and you can't let on to stuff like that. And I'm not dog whistling anything. It's a sincere question. What's the strategy there?
So when you're the little company, and I'll talk more from when I was at Pfizer and did acquisitions and licensing. You're the little company, and you look at, what do I need to do to get to the next level or next series of levels? And then you weigh the risks of that and the dilution, the cost of capital. And that's what you're kind of measuring against what a larger company who can, for Pfizer to write a check for $100 million against a $40-50 billion income line, it's really small. For a company that has a market cap of $100 million, it's a game changing. And for the investors, the CEOs are sitting there looking at it going, I can take a licensing deal, the stock will go up, we can do other things, or I can gamble again. And by the way, I've worked with companies and been involved with things where you turn the card over and you got to do another phase 3 trial, and there's another $200 million, and it changes it. It's a risk versus reward.
Yeah, I want to have you back on the show because we, like Mike said, you'd have your whole hour. Real quickly, just in 30 seconds, what are you looking most forward to this year?
The combination data. Our combo study should start very soon, and by the end of the year, we should have some data on it.
Jeff Meckler, the CEO of Indaptus Therapeutics, the first of many more visits with us, we hope. Of course, our ticker symbol is INDP. Jeff, thank you so much.
Thank you, Chief.
All right, keep it here. Lots more to come with the Big Biz Show after this. That is going to do it for this edition of the Big Biz Show.